All right, good afternoon, everyone. Okay, we're going to get started once we see a few more people jumping in. My name is Brianna Blakemore from the Houston Health Department. I am the Public Health Investigator Supervisor of the Outbreak Management Unit here at the Houston Health Department in our Public Health Science and Surveillance Division. Okay, so today we are going to just talk about how the Outbreak Management Unit within the Houston Health Department has been working to mitigate measles in the Houston area. So currently, within the Outbreak Management Unit, we are working to support our Bureau of Epidemiology with the contacts that we receive for any confirmed measles cases. And so with that process, we are currently identifying the contacts and their exposure level. Good afternoon. And identifying any additional resources and how we can help mitigate the spread of measles. So thus far in our efforts, we are essentially doing some contact tracing. So with that includes identifying immunity, vaccination status, any possible risk factors, and exposure information, and collecting any necessary client information that can help us further in our investigation. We are also supporting other jurisdictions in their investigations so we could all collectively or collaboratively work together to mitigate the spread in Houston and across Houston. And so with our efforts, one of the things that we are working in the community to do is to inform the public in our communications. So some of those communications include phone calls to those that may be possibly at risk or exposed. That also includes referencing our information that is posted on houstonhealth.org on our website, which includes an extensive list of signs and symptoms and additional information regarding measles. So in regards to the information that we share with the community, we try to give as much information as possible within the information that's listed on our website, currently on houstonhealth.org, for signs and symptoms to look out for, how to identify whether or not you have been vaccinated against measles. And in order to do that, we provide information and refer clients to their PCPs. And we also provide additional guidance regarding how to communicate with your PCP if you are experiencing symptoms. So we also are working extensively with our teams to ensure that we are communicating effectively with the community. So with that, we are reaching out to our clients that may have been exposed via phone. If we are unable to reach our clients via phone, we are actually going into the field to support our investigations. And with that, we are cultivating letters that are pretty general, that basically communicate to the person of interest that we are needing to get in touch with them, And so with that, if we are reaching out to anyone in the public that may have been impacted or exposed, it is very important that you are communicating back with us so we can further assist you. So, how can people check on their immunization status? So, you can check on your immunization status by reaching out to your PCP, and they can identify that information for you, whether they have records on file or whether they need to do any additional testing to confirm your vaccination status or immunization status. Okay, question. Do we call people about their measles diagnosis? So we do not directly call patients about their measles diagnosis. In the event that we are conducting an investigation of a confirmed case, that will be handled by a different area, depending also where the exposure occurred, whether it's in our jurisdiction or not. However, my unit specifically will be contacting those who may have potentially been exposed by the confirmed case, and we will communicate with them on any further testing needs or further not testing, sorry, any further needs from their PCP or any additional resources that may be needed. So additional information can also be provided on the houstonhealth.org. Okay, so that is all I have for this afternoon. Thank you, Houston, and all those who joined us.